Hi, my name is Gianna Lombari and I'm a nurse practitioner here at Advanced Dermatology. Acne scars are the result of inflammation and trauma to the skin from a blemish. When we have a blemish, it can cause a breakdown in the wall of the pore. And sometimes the blemishes can even cause their contents to leak into surrounding tissue, which causes a deepened scar. It's really important for patients to understand that. Unfortunately, this is a very common issue. 80% of people between the ages 11 to 30 will experience acne, and 90% of adolescents too experience acne. And then we estimate that about 1 in 5 of those people will end up with acne scars. That's a good question. So it really has to do with your specific genetics as well as your skin's ability to repair itself in response to trauma and inflammation. Sometimes when the skin is experiencing the inflammation and the trauma, it causes a decrease in the tissue, which leads to an atrophic or indented scar. And other times the body works so hard to repair that damaged tissue that it ends up getting too much collagen production, and this causes a hypertrophic or raised scar that we call keloids. The most common atrophic scars we see are boxcar scars, which have a U-shaped depression, a ice pick scar, which is a V-shaped, very deep, narrow scar, and then something called a rolling scar, which is a wide depression with very distinct rounded edges. Well, the number one thing you can do for yourself is to prevent them in the first place. So this means that the second teenagers and adolescents are starting to break out, getting the kids in to see the dermatologist, and even when people start breaking out for the first time in their 20s, getting in as soon as possible so that we can talk about education and get you on a managed program to make sure we're mitigating those breakouts and preventing scars in the first place. The other thing is no picking, no popping at home. So this is the exact thing that causes more inflammation and that spilling of the contents into the surrounding tissue that I had mentioned earlier. However, if we do end up with acne scars, there are many things that we can do in office to help treat you and get you looking your best. One of them is chemicals that we use as chemical peels, different types of acids like alpha hydroxy acids. What these do is it causes the shedding of the damaged tissue and makes way for a amplified type of repair in that tissue, so the skin can grow new, healthy tissue. Similarly, we use topical retinoids like tretinoin, which work to shed away that damaged tissue layer, and as it sheds away the bottom layers, it creates a new healthy tissue layer, as well as works to flatten that indentation of the scar. And then probably most beneficial, what I see the best results for very severe acne scars are cosmetic procedures, things like microneedling, intensive laser, and Fraxel laser. These lasers create micro injuries into the skin, which allows for new collagen growth. One of my favorite lasers to use is the Fraxel laser, which is a non-ablative laser and doesn't have very much downtime. In fact, the best time to use this is right now in the fall and going into the winter, because we have to avoid the sun for a week or so after, and this is a great time to get on that regimen.